It's currently 1:08 p.m. Can we have a roll call, please?
Calling the roll, Ms. Conwell,
Present.
Mr. Jones,
Here.
Ms. Brown,
Here.
Mr. Miller,
Here.
Ms. Stevens. Ms. Stevens,
We muted there?
She's muted, but we see her.
we have a quorum. Also let the record to reflect that Council President Brady and Councilmember Baker are also in attendance.
All right, thank you. Madam Clerk, is there any public comment that was sent in?
Yes, I did send an email. Ms. Lou sent public comment for you all to read.
All right, thank you, and that is noted in the record. I'd like to have approval of the minutes from the February 19th, 2020 meeting. I'd like to make a motion to approve those minutes. Is there a second?
Second.
Okay, the minutes have been approved and seconded. All in favor say aye. Aye.
Aye.
All right. There are matters referred to the committee today. Today we will consider the appointment of David Merriman to serve as the Director of the Department of Health and Human Services. Just for a little background, the Department of Health and Human Services was established under the county charter and its operations formalized in our county code. Should he be confirmed, Mr. Merriman will be installed as the county's Director of Health and Human Services, and he is not unique to this. The hearing process will proceed as follows. Mr. Merriman will be offered an opportunity to address his qualifications, motivations for seeking the position again, and outlooks and plans regarding this office. Council members will then be offered the opportunity to ask questions of the nominee. We will do so in rounds, allowing each council member to ask 2 questions per round until all questions have been answered. I know President Brady has another call, so we will let him go first if he has questions. Once all questions have been asked, we will entertain a motion to recommend the council approve or reject the nomination at the next regular meeting. If we're not ready to act on that motion today, we will defer making the recommendation. Assuming a motion to recommend approval or rejection has been made, council will vote on that recommendation at its next regular meeting. Thank you. And as Mr. Merriman, I can see him. Is your mic on? Because I can't hear you, Mr. Merriman.
Yes, it is.
All right. And we're ready for you to begin.
Ms. Conwell, would you like me to read it into the record?
Oh, yes, please.
Resolution number 2020-0092, confirming the county executive's appointment of David Merriman upon his taking the oath of office as Director of the Department of Health and Human Services.
All right, well, good afternoon. David Merriman here. I am the Interim Director of Health and Human Services. If I can go ahead and begin, I'd like to begin with a very brief presentation that I've provided to council. As I move through the presentation, I will just be asking staff to advance the slide. Noticed on the first slide a typo. It's not May 5th, it's May 20th. So I will amend the presentation. If you could advance the slide, I would appreciate it. So I first do want to recognize I'm joined here in the committee chambers by several of my colleagues, Michelle Pomerantz, Walter Parfialowitz, the past Director of Health and Human Services, Leon Harris, who is the Director of Performance of Innovation and Evaluation, and DHHS, Michael Chambers, Mary Louise Madigan, as well as council staff. I also know that many of my team members are watching this video. We do understand the need to have social distancing. I've taken off my mask, but I know that they wanted to be here, but respected the order that no more than 10 people should gather. I'm gonna jump straight in. I'm gonna move quickly through this presentation to preserve as much time as possible for council questions. So I'd like to begin by saying DHHS is the safety net for all county residents. We are here for every resident, and the services we offer are intended for the needs of our community. We frequently will talk about serving thousands and hundreds of thousands of clients, but at the same time, we are talking about men, women, and children living in our communities. These are people. They are residents that have real needs, and our job is to address those needs. So there may be professionalism in terms of our terminology and our presentation, but we will never lose track of the reality that these are human beings that deserve the respect and have rights that we will ensure are provided. That's why there will be such a commitment to customer service that will come through in our presentation. I also just want to recognize that the county charter speaks to the role of the Department of Health and Human Services and the job of the director. And I know frequently there's a use of terms that are social problems. We tend to talk about our clients as homeless or children as victims of abuse and neglect. And I think it's important for us to recognize that our clients, our residents, and our communities are not defined by their problems. Our job is to help them work through their problems, but there is much more to them. And it is our goal to help residents fully participate in our county's economy, in community assets, and to really provide for themselves and their families in the way that we expect for each other to provide for ourselves and our families. Please advance the slide. I want to share a little bit of background on myself. First, on a personal level, I'm a resident of Cuyahoga County. I was born and raised about a mile and a half from where we are right now. And I still live in the area with my children, near my father, and near the community that I was raised in. I moved to Portland, Oregon in the late 90s, quickly recognized that I belonged in Cuyahoga County, and I wanted to return to Cleveland, Ohio. While I was in Portland, I volunteered in the child welfare system. I felt like it was an experience, a profession I wanted to explore, and I had an unpaid internship, and I felt that this was an exciting field and something I wanted to work in. So when I moved back to Cuyahoga County from Portland, I immediately applied for a job in DCFS, and I'll be talking more about that next, but I want to share that my professional career began in the Division of Children and Family Services. I've had other wonderful public experiences that I'll also be talking about. And I also want to share that the county is where I want to be. I think there are many opportunities in life, and I feel enormously privileged to have been given the opportunity to serve as long as I have in the county and into many different roles. It's something that I will carry forward in this next job. Please advance the slide. So in terms of my professional background, as I said, my job in the Division of Children and Family Services was my first real job. I served as a social service worker 3. I managed a caseload. At that time, caseloads were much higher. They were in the 20 to 30 range. And although I did that work, I learned a lot. I don't consider myself an expert. I would always say that if you have real questions about child welfare or DCFS, you need to give Cindy Weiskettle a call. She's the director. She's the expert in the room. But I am extremely proud of my time and the work that I did. I recognize that when I served in that role, I chose to have my caseload be from the community that I grew up in and I lived in. I felt like it was important for me to be willing to live near the people that I was serving. It made for some awkward times if I went to a video store or a supermarket and I bumped into a client. And if we were in the middle of a contentious time in a case, it was sometimes a contentious interaction. But I still felt like I could do that the work that I do is honorable, and the work that we do is hard. We have to make very difficult decisions. And I will always support the staff of DCFS to make the best decision they can with the best available information, even though it may be extremely difficult. After working in DCFS, I spent 8 years in the city of Cleveland working in the Department of Public Health. I worked on infant mortality prevention as well as HIV, STD testing, referral, treatment, and housing. I also had the opportunity to work on some more complex problems that I'll talk a little bit about. When I returned to the county, I had the opportunity to work in the executive's office, and I'll be sharing a little bit about the Board of Control. I then moved over to Cuyahoga Job and Family Services. I worked there from 2014 through 2017. And so I've really come to understand the complexity of the systems that are operated through CJFS. Medicaid, SNAP, TANF, child support are very complicated systems. And I understand that when the public has the opportunity to apply for benefits or to get support, they frequently talk about how complex and how difficult it can be to navigate our systems. Federal programs are unfortunately not designed to be simple. They're designed to be accountable. And so I'm very interested to find out how we can do a better job of streamlining and make more simple the programs. But at the end of the day, they will continue to be complicated. And with COVID, they have been made even more complicated. And there's a lot to talk about as it relates to COVID. Much of my work since becoming the assistant director has been to focus on the other departments that are in DHHS. These include DSAS, Early Childhood Reentry, Family and Children First, the Office of Homeless Services, and then our shared services. And I really now understand the work that they're doing in a much better way and have really a tremendous amount of respect for the leaders and the staff that are in each of those systems. The last point I'd like to make is that the Board of Control is a project, a board and a commission that I had an opportunity to serve on, but it's not the only one. I will be saying more about the Board of Control, but I've also participated in a governor's task force to reduce dependence on public assistance, invest in children subcommittees, and the Office of Homeless Services Review and Ranking Committee. Much of that was before my time in the county. If I could move forward, please. So want to share a few accomplishments, and I'm going to talk in the first person, but at the end of the day, I just have to recognize anything that I did well on these projects, I did as a part of a team. I don't stand up and say I deserve credit for that work. I was a part of a large group, an effort that generally involved the community, and we accomplished the things that are in front of you. The first is the Board of Control. This is something that came and was developed very quickly in 2011 when County Council provided the then county executive the authority to execute contracts without much additional process. That executive turned to me and said, I'm not going to sit in a room signing contracts. What are we going to do? 2 days later or 3 days later, we had our first Board of Control meeting. I want to say a week or 2 weeks later, council was a part of that Board of Control meeting. And I feel like that process was very iterative. We started with a pretty bare bones agenda, and we allowed it to grow. I think we worked very closely with council members Miller and Jones as the chair members of the procurement committee. But I felt like through that initiative, we really developed a model for government that is much more nimble and responsive. I do want to talk a little bit about our Pay for Success project. For those that don't know, the work that the county did to launch a Pay for Success project in 2014 was groundbreaking. We launched the first county level PFS project in America. And that project has since wound down. We did not make success payments, but we succeeded in many ways in terms of reunifying children with their families. I'll be talking a little bit about that later as well. I also want to talk a little bit about the JFS modernization effort. We accepted a partnership offer with the state of Ohio. They brought resources to us to modernize our services, focus heavily on switching how we engage clients from a model that had us scheduling appointments and calling clients based on our schedule, not theirs, to one that had clients call us when they were ready. I give credit to County Council for much of this decision and this change, as repeatedly council members such as Councilwoman Simon and Councilwoman Conwell just recognized we could no longer continue to be the focus of feedback that we weren't returning clients' calls. I committed then, and I will commit now, that we will do a better job with our customer service, and I think we're doing that. I have some great slides to show on that coming. I do also want to recognize that the team that worked with me is the group that really moved this modernization and this call center model forward. At that time, it was Jackie Ward, Christy Nichols, and others that actually engaged direct service workers. They engaged eligibility specialists. They met with middle managers and center directors to customize that system, to have early lessons learned and to continue to improve it. I also just have to give a huge acknowledgement to Kevin Gowan, the current director of Cuyahoga Job and Family Services. Even though that work began under my term, Kevin has done much more with it than I have. I actually would say that he's a better administrator for that model than I would have been. And I think the work that they're doing to continually improve and refine the model is the work that you would expect of us. And we're very excited about some of our early progress. The last thing that I should recognize is that I do have significant experience working in public health and have implemented a number of programs I worked closely with the Office of Homeless Services when I was in the Cleveland Department of Public Health to integrate our data system with OHS's data system so we could have improved coordination between the city and the county. A big thanks to Ruth Gillette for offering to do that. I worked closely with Terry Allen, Latoya Walker Minor, Merle Gordon on a number of programs and initiatives, and feel like I have a strong relationship with the public health system. Especially in light of what we're dealing with now in COVID, early work that we did with H1N1, early work that we did with West Nile, I think has prepared us to have the response that we've had. If you could move forward, please. I'm on my last 4 slides here, I promise. So here are some goals for 2020 and 2021. So I think the first that I'd like to recognize is COVID has changed everything. I think maybe we'll go back to we have a health and human service strategic plan. It's alive, but COVID is defining the work that we do. And so we will review the plan and determine what changes need to be made to it as a result of COVID. Jennifer Crossman and Deanna Kirkpatrick are doing an outstanding job tracking our progress on the plan. We're available to present to council as requested, but I'm going to tell you that COVID has affected every component of who we are and what we do. And so much of the strategic plan will be reviewed. Hopefully we are in the middle of COVID. And when this phase ends or there's a significant cool down period, we'll be able to complete a review of our systems and our responses. Hopefully there'll be some changes and some good lessons learned. When we do this, we will work closely with public health and justice services and others. Before, use a screenshot of a meeting that we do on an ongoing basis. Ongoing being we have our second one tomorrow. But we're regularly meeting with all of the departments in HHS, as well as the city and the county health department, as well as the Emergency Operation Management Agency, to get input from them about our response to COVID. That's going to continue. We're going to talk about what we need to do over the next year, and then we're going to talk about what we did and try to learn from it. A last point that I'll make on this. There is significant opportunity for staff to provide input, and there will be more coming. We know that as much as we try to make the best decisions and try to have informed meetings, we know that we aren't getting as much, all of the input that we would like. So we're doing more. Leon Harris, I should introduce him as Dr. Leon Harris, is on my team. He is a researcher that is the manager of or the director of performance innovation and evaluation, and performance evaluation and innovation. He recently did a survey that went to all of our DHHS staff to get their feedback on how telecommuting is working. I'm really excited to announce 78% of staff responded to the survey. He sent it over to 2,000 members and over 1,500 responded. People want to provide input, and we want to hear them and then respond to that input. Leon and his team is doing a great job surveying. We're going to be doing more of that, and I'm going to be very excited to share our findings from it. If you could advance the slide. I think the second part of what we really have to understand is what is the response to racial disparities that exist within DHHS. I know this is a sensitive issue. On a weekly basis and sometimes daily, we're called to review the work of the community as it responds to racial disparities and racial inequity. 3 of the slides in front of you are communications that have been sent to me this year about how we should be doing more along this work. And the efforts and the requests involve the homeless system, workforce system, child welfare, and many others. These efforts need to move from discussion to action, and it has to pick up the pace. There has to be more urgency in our response to this issue. I think we know that, and we knew that going into 2020, but I think COVID has also demonstrated the importance of this and how we have to do a better job of tracking and responding to racial disparities. This is something that will take a lot of work and will require feedback from all levels of the organization. The way that I'm going to move forward on this is we're going to begin by disaggregating reporting to start to report on what impact are our programs having and to report that by race. This disaggregating of reporting is a critical step so that we know what our data tells us and we're responding to the data. The second part will be to ask each of our departments to review that data, to understand what their programs are experiencing, to get input from their staff, and to come up with strategies that they think are achievable, but also actionable in a short term. And the third area is to designate leadership to drive this work. I will choose a senior manager from within my team that will be accountable to advance this work and to collaborate with partners internal and external to the county. And then lastly, we can move to the second to last slide. So I will admit to being very enamored with data. I don't think data should be the end all of what we do, but I do think we should be making more data-driven decisions. And this is something we do, and I feel actually is a strength, but we could be doing more with. And we know that we've heard this from the community. This was a theme within the levy campaign. As we responded to questions about what does Health and Human Service do with levy funds, we recognized we weren't communicating enough. We weren't telling our story. In times we were defined by critics. So we will do more communication. We will provide more frequent and more in-depth communication about the amazing work we do. We should be proud of our success. We should be proud of our accomplishments, and we should be brave enough to recognize when there's lessons learned. I don't think communication has been as proactive from me as I would like. So I will make that commitment that this will be a priority for me, and it'll be a priority for DHHS. We have outstanding communication resources in both our department and the county in general. We just need to do a better job of getting the message out. But a last point that I'd like to just make, and this is that final point there, I do think we have to expand program interoperability. As I've just been saying about my work with the Department of Public Health, there are opportunities for us to align with other systems, be they public health or the Adams Board or developmental disabilities, that make sense. It makes sense to everyone. However, we're all busy with our core jobs and responsibilities. We're all challenged to be centers of excellence. But at the same time, we have to be willing to reach outside of our silos. I don't think this is a new idea. In fact, I know that we have many successes with this, but this is another area we can do a better job. And it's something that I'll commit to, that over the next decade, the challenge for departments to be able to promote and improve interoperability will become a core requirement of all government. So if we can go to the last slide, I'm going to end here and say thank you very much for considering my nomination. I'm very humbled to be given this opportunity and the chance to serve as the Director of Health and Human Services. This has largely been my career in working in this organization. I've taken custody of 10-year-olds. I have told grandparents and parents they'll never see their children again after our last visit. At the same time, I've done HIV testing and told individuals that their behaviors are putting their lives at risk. The services that we offer are core safety net services. Our community cannot exist without them. But these are services designed for residents, and we need to do a better job of helping residents to access and respond to those services. And I think with the administrative team that's been assembled, that we can respond to any challenge, and COVID will show that the challenges are not ones that we don't understand going into a year, but we can learn from, and we can adapt, and we can improve our services. So thank you very much for this opportunity, and I'd love to hear what questions you have.
Thank you very much, Mr. Merriman. I would like to open up for questions from council, and I would like to start with Mr. Brady because he has a limited time. President Brady, if you have any questions.
Thank you, Madam Chairperson. David, glad to see your appointment. I feel like council has gotten to know you pretty well over the years. Your work in the Health and Human Service Levy and helping us communicate to the community the need for our services was outstanding. And in fact, you have this unique strength in your ability to communicate. And I think that's going to be very important going forward. What I wanted to ask you, given the limited amount of time, was if you could, if you're comfortable with it, since the things changed dramatically in the middle of March, I know that you've been involved in a lot of the county's activities around COVID and around our responses. And I would wonder if you could just give us a little sense of what you've been involved in for the last 2 months.
Absolutely. And thank you, Councilman Brady, Council President, for your compliment about my work on the levy. I think the principal focus for this first phase has really been around homeless services. I think there's an enormous challenge. The Office of Homeless Services has a small team. They lost several members going into 2020 due to retirement. And I think nationally there was the recognition that COVID would disproportionately impact the homeless. And I just want to acknowledge Ruth Gillette, Melissa Sirak, and the rest of their team have done an outstanding job responding. Their initial focus was to decrease the census in the shelters. And so they acted quickly to work with Lutheran Metro Ministry to bring hotels under contract that would enable us to have less people in shelter and more people in individual rooms. They've just really done an outstanding job. They moved at least half of the population out of the shelters into into hotels. And, and I think that was the first phase. I just have to acknowledge that Lutheran Metro Ministry has extended itself so far that I just truly appreciate them and the leadership they've shown. And a huge kudos goes to them as an organization. After we stood up these social distancing hotels, we then began to focus on preparing a hotel for discharge. When individuals that were diagnosed with COVID were to be released from a hospital, and they didn't have a home to go back to, or their home wasn't appropriate for them, we had to identify some other location for them. We heard this from the homeless service advocates, from the homeless system. We heard this from the hospitals, and we heard it from public health. So we act quickly to assemble an approach, working with frontline services, with Visiting Nurses Association and area hospitals, to identify who has open rooms and what services need to be provided on site. We've now stood that up. There are hotel beds available for people being discharged either from hospitals or from shelters directly, that are responding to the needs of individuals that can't go home because they don't have a home, or because their home isn't conducive to someone with COVID. We're now on to a third phase, which is testing in the shelters. And I got to recognize Metro Health has been an outstanding partner in this, as has the Board of Health and the Cleveland Department of Public Health. They are systematically moving through the shelters, testing the residents, and working to ensure that any infected resident has access to that hotel and all of the other services they need to be healthy. As we complete testing in the homeless congregate care facilities, we're going to move on to other congregate care facilities, such as group homes and other forms of shelter. So this is going to be a work it's going to be ongoing. We do a weekly call with the Board of Health and the Cleveland Department of Public Health to have all of our departments bring forward their COVID questions, so that we're looking to public health to provide guidance. The other groups that are on deck that will have significant efforts, the Office of Reentry is already engaging in a very, very real policy and program review as more and more individuals return to our community. Child welfare will be doing much more, as will Senior Adult Services and Office of Early Childhood. Ultimately, COVID will affect all departments, and all departments will be working on it actively.
Thank you, David. Just want to say that I think that Cuyahoga County is very fortunate to have you as part of our team, and so we look forward to working with you in this position. Thanks.
Thank you.
Is there any questions from any other committee members?
Yes, Madam Chair.
I have questions as well.
All right, Jones and then Miller.
Thank you. Well, Dave, again, congratulations on your nomination and getting to this part of the process. My question revolves around, you mentioned the homeless individuals who have been, are now being tested by Metro Health. I think that's excellent. I'll ask the same question I asked of the county jail. How about the employees who are they being tested more than simply a check for a fever, the swiping of the forehead? And the reason I ask is, my feeling has been that a simple swiping of the forehead does not capture those who are asymptomatic, and those who could potentially have it but not show symptoms still move in and out of the facilities. I think it's important that aspect be captured as well as to the best of our ability, to the best of Metro's ability.
Yeah.
Tell us where we are in regards to that.
Great question. The team at Metro Health has worked with us from the get-go. And even though the first phase of our response, the social distancing, did involve us screening individuals, much of the testing wasn't available at the national level. There was a lack of federal resources on it. And so Metro Health began by screening people in the same way people are screened walking into our buildings. That has changed. We are now talking about COVID testing for both the residents of the shelter as well as the staff. I want to say at the first shelter that we tested in, they tested 170 individuals, 65 of those were staff, and 110 or 105 were residents. We tested them all, and we will continue to do that. So when we are planning these testing events, they are for the residents and they are for the residents of our county that are there serving those individuals. And as we identify people that are positive, whether they're a staff member or a participant in a program, we're offering them resources. So yes, we are testing, and we are testing staff and residents alike.
Well, that's good to hear. You could test every day, but there's got to be a realistic. What is the amount of testing? You test the employees once a week, or do we know at what rates we are testing them?
My understanding is there's a limit on the amount of testing that Metro Health can do.
Okay.
The county has been very aggressive on this. A few weeks ago, our county executive, Armin Budish, announced a new partnership between the Board of Health and Metro Health, where we're going to be testing thousands. I think he put $5 million towards testing something like 30,000 individuals. And but Metro Health right now still has the capacity to do around 200 tests a day. And so we also have to really think about how many tests you do at a time, because let's just hypothetically, if we were to test a number, but we didn't have the resources for them that day, we would create a logjam. So having an incremental approach, testing people more regularly, working through these programs in a systematic and methodical way is a better approach. That's exactly what Metro is doing. They're doing it in partnership with the Cleveland Department of Public Health, the county department, the county board of health, and then social services partners involved.
Right, I understand. I appreciate that. I didn't get that sense when I talked to the county jail leadership yesterday that employees were being tested. But Metro obviously is doing the hard work, the rolling up of the sleeves and providing this testing for not only in your department, but I would say the county jail as well. So I'll have to revisit my conversation with the jails, because if they're testing with you, I'd like to think they're testing in the jails as well, the employees. So again, that's my question for now. I'll pass and come back with future questions.
Okay.
Mr. Miller, Councilman Miller.
Madam Chair, to Mr. Merriman, I would also like to congratulate you on being recommended for this appointment and compliment you on the very wide range of backgrounds, ranging from DCFS to public health to jobs and family services. Your experience covers a broad spectrum, and I'm sure that's going to be very valuable to the county. My first question is that we need to have an overall plan in place to rid the county of COVID-19, and I don't think anything like that's actually been written down anywhere to my knowledge, but I think it implicitly exists in terms of the action plan that we're pursuing, and based on your experience in public health, I'd like to hear how you would describe what our plan is to get COVID-19 out of Cuyahoga County.
Well, first, Councilman Miller, thank you for your compliment. I appreciate it. I've enjoyed working with you. And I think we've done some very interesting things together with the county. as to where we are with COVID and the plan, I would recognize we developed continuity of operation plans in DHHS. We included conversation about pandemic, but I think there's a certain amount of humility that really has to be embraced in this time. No one thought this pandemic would play out the way that it did. No one could think that. And so although we did have plans in place, at the end of the day, I think the brave leadership of our governor, Dr. Amy Acton, and then our county board of health, our Cleveland Department of Public Health, our county executive, and county council. I think the response that we've had has absolutely transcended the need for a document that existed under pre-existing conditions. I feel like the work that we're doing, it's a daily iterative process to understand the nature of this pandemic and to respond to it. There are daily calls between Health and Human Services, Public Health, the Emergency Management Agency, and the Emergency Operations Center, where we're forced to look at what are the issues that matter for today. Now, we are tracking and we are committed to creating the record out of this initiative that will ultimately be used for future planning efforts. We're learning a lot and we don't have all the answers. Right now, our focus is on what do we need to do immediately and what do we need to do next. At some point, as I said in my presentation, we will do a review. We will look back at this time and we will identify what are the changes in our system that need to occur for us to be more responsive in the future. At this time, though, as we've responded with a sense of urgency and really a focus on what's in the best interest of our residents, it has been about services. The focus has been on test, treat, and refer. And that's exactly what we're doing. And I think as we do that, we're building the plans. As we do that, we're refining our models. I have one protocol on how we utilize this hotel that is available for residents. I think we're on version 7 of it. It just continues to evolve. And that iterative nature is uncomfortable at times. I know that many people would like to have all the answers, and we just don't, that's not the environment we're in. I think if we follow the leadership of Dr. Amy Acton, as well as folks like Dr. Heidi Gillette, or Meryl Gordon, we know that this pandemic is changing, it's evolving, as is our response. And we have to do a little bit of work on a daily basis, understand it, and then make changes. And that adaptive work is really defining our approach to COVID. And, and I think in the next year, things will change and we will have a better sense of the next wave because of the work we've done now.
Thanks for that response. And Director, I'd like to follow up by asking you to comment on 2 aspects of the implicit plan that I think are emerging as our economy starts to reopen. And the first one is that all of the services we provide, all the testing, the tracking, the referral, the healthcare, all of that isn't going to be fully effective unless the general public embraces the continued seriousness of the problem and continues to take very strong action to employ safe behaviors and to avoid high-risk situations. And so I would like to get your comment on what we need to do and should be doing around public education in that area and how we would do that. And secondly, related to that would be the importance of working with the business community as they start to reopen about how they do so in a safe and effective manner.
Very important questions. And as someone that has a background in the human services, Councilman Miller, I think you understand that it is very difficult to change behavior. And I think we can look at our society and we can look at things like smoking, or we can even, if we have to, we can look at things like epidemics like HIV that have existed for a long time and yet are still problems because unfortunately communities don't change their behavior, even when confronted with death and morbidity. So I want to just first by, so your question about all those services aren't going to be affected without behavior change, you're right. I think that is part of the reason that we've really decided that public health will lead us. We are not public health professionals. I may have worked in the Department of Public Health for 8 years, but I don't have the knowledge, the experience, and the access to resources in the way that Terry Allen or Dr. Heidi Gillette or Merrill Gordon, or for that matter, any of the physicians that are working with us from Metro. We are in a medical model right now, and it is all about test and treat and refer. And that's really what we're doing. And I think as we recognize that there are hotspots, there are communities that are more at risk, we're beginning with them. We're trying to identify who in those communities are at the highest risk or have already been affected to be able to draw down the virus load within that location. And I think with that comes behavior change. I think the moment that you start to test within an organization, you really begin to show this is not a hypothetical. This is not a possibility that this virus is present. We will unfortunately show that the virus is present and that people are fighting it. And I think that's the right moment for you to really focus on behavior change. And unfortunately, our society has not done a good enough job at looking at health outcomes and wellness. And COVID is really confronting us, forcing us to consider. But again, I do want to just emphasize, I'm going to work with public health. They are the experts on behavior change as it relates to managing a pandemic. Our partnership with them is strong and it's growing, and that's going to continue to define us. As to the question about the business community, we are thinking along the same lines. We're starting with the businesses that we're most concerned about. And so right now we're talking about what are the needs of childcare centers? How do we respond to those many childcare centers that there's a double bottom line? They're businesses or they're nonprofits and they employ residents, but also they're the key service that many residents require for them to be employed. So we're beginning to ask the question, what do you need to open back up? How do we help you help us in our economy? Same sorts of questions are being asked for long-term care facilities and many other. Every day we talk to workforce or we talk to social services to say, how are you helping residents help businesses and how are you helping businesses find residents? Even though we're in stay at home, or I guess maybe now safer at home, we're still pursuing workforce outcomes that meet the needs of residents and businesses. That won't stop. In fact, that will increase as we have done a better job managing the COVID crisis.
Thank you very much, Madam Chair. I have further questions, but I'll pass for now and wait for the next round.
All right. Who would like to be next?
I'll take another turn if none of my
All right.
colleagues.
Mr. Jones, and then we'll
Okay.
see if there's anyone else. If not, we'll go to Mr. Miller.
Okay. I'd like to know how you've been working with Terry Allen and with your staff in terms of the Department of Senior and Adult Services as they work on what you just said in terms of nursing homes, hospitals, just the frontline workers. What feedback have you gotten so far, if any, as to what their needs are?
So I should take a moment first and recognize that the work that Terry Allen is doing, that Dr. Heidi Gillette, that Merrill Gordon is doing, I have to admit, I am so proud of them. I think they are working at an unbelievable pace. They are staying on top of these issues, and it's our responsibility to support them and to find ways to lighten their load so they can focus on the overall management of this disease. The example you bring up of DSAS and the work they're doing, Tracy Mason has an outstanding team of professionals, and they all want to have a meaningful impact. And so Tracy is developing proposals that are still under review that will really look to how do we reach more residents and ask them how they're doing, a wellness check, or possibly some additional services that we can offer in their home. At the same time, Tracy's also offered to help do more communication with long-term care facilities. All of this is going to occur in consultation with the Board of Health. If we do a communication, we're going to say, tell us how we help you. And at the same time, if you have needs for PPE and you don't know what how to have those needs met, we're going to make a referral to the Emergency Operations Center. The EOC is the leader. They are the central repository for those resources and disbursement of them, and we're going to support their work as well. So this is really, I know it probably moves at light speed and it gets blurry, but I just will commit to you, the collaboration that's occurring now between Health and Human Services, public health, emergency operations, it's daily, it's hourly. And we're really, I think, focusing on how to best meet that need. I'll give you one last example. Over my shoulder is a colleague, a gentleman by the name of Leon Harris. And Leon is the point person for all PPE requests coming through Health and Human Services. And in that way, what Leon is doing is saying, okay, first, departments, what do you need for your staff? How do we meet the needs of the residents that are also employees, or the employees even if they're not residents? Secondly, how do we meet the needs of the clients being served in your organizations? And so Leon has been facilitating requests into the EOC for disbursement of PPE that will go to both employees and clients, and then the staff of these organizations. And in that way, we're making sure that nothing is getting lost. And departments have the ability to make those requests directly if it's an emergency, but we want coordination, and the EOC wants coordination.
Okay. Dave, Director.
Outreach, as we bring services back online, you're going to see communication from us.
Can you still hear me?
Yeah.
Okay. I'll put my other hat on as a funeral director. I have received the emails request for me to respond and talk about our needs as a funeral industry. I'll just in general speak to what I think, what are some of the needs. Testing first and foremost. Again, testing for employees to know who should be in the facility, who should not. PPE is always, they're always needed. Masks to keep social distancing and wear masks when you have to do essential work that does not allow you to distance. Support, third, I would say support at staffing levels. There are times when staff can get strained. Some people leave work because of fear. Some are sick, can't come in. But if staffing levels get strained in whether hospital or nursing home, or even at our back end of the front line as a funeral industry, those are the things that I expect as you get responses from the surveys. Those are the things that you'll start to hear comments about.
Councilman, first, I want to agree with you. I think we're dealing with a lot of those same issues, and there are a lot of questions, and I think each organization is going to be confronted with how they respond and manage the COVID within their own environment. But we want to support them. Businesses are important to Health and Human Services. My colleague Ted Carter works very hard to support businesses in our community. Paul Herdig, Sarah Parks Jackson, David Feinerman. I know they're working very hard. We need businesses to be strong for our clients to get good jobs. And so they're, to me, it's a continuum, and I don't see it as being defined systems. And so, this is why we're reaching out to the networks that we naturally support, whether it's long-term care facilities, whether it's nonprofits, whether it's child care centers, or it's manufacturing organizations that, that all matter. They are critical because they're critical to our community and they're critical to our residents. And we support them. And I think as we're also taking a no wrong door approach, because as they say to us, I don't know where to go for PPE. Well, maybe that person doesn't know, maybe someone else in their organization knows, and they just need to check in, or maybe they truly don't know. And if that is the case, our job is to refer them to the Emergency Operations Center for a resource request. And I know that request will be honored. Maybe they'll ask for things that aren't available, but if we have them and we can share them, I know Alex Pelham is extremely aggressive at pushing out PPE, and but also tracking the reality. I'm sorry to hit on the euphemism, but this is a marathon. We're going to be doing this a long time. We've got to get PPE for the long run. And because I think we're going to be having this conversation for the balance of 2020 and beyond. So I just would recognize The key challenge is coordination, but I think this is where this form of government in the Cuyahoga County is way ahead of Ohio and probably America, because we have that coordination because of our structure and our relationships.
Dave, are they selling the PPE or are they just providing?
I'm
if
sorry?
so, are they selling the PPE or are they, do you purchase it as a vendor? Do you purchase the PPE from EOC or do they provide it when you request it? How does it work?
Yeah, I'm going to defer to Alex Pelham on that question. I'll ask him to confirm. I've never seen a charge for PPE. I think if PPE has been provided us from the strategic stockpile, or we have purchased it with our own dollars, we're providing it and making it available. But Councilman, I'm going to follow up with Alex Pelham, the Director of Justice Services. I'm going to ask him to confirm if that is correct.
Okay, I'll move on to my next question then. The $215 million that has come in, we know we can't use it obviously for our own. We know what the purpose, the stated purpose is right now. Have you put together a strategy, and can you tell us what you can do with the dollar, what you have planned to do with any of these dollars or requested to do with any of these dollars based on the guidelines already in place for the money?
So it's an important question, and I just would say we are using the money now. We're going to keep using it for the rest of the year and as long as it's available. So some examples of how we're using those resources now. I talked a little bit about the hotel that is available for people being discharged with COVID that can't go back to a house. That's an encumbered cost against those funds. The on-site service provider is to be charged to those funds. The facilitation of getting people from the shelter or the hospital, that's going to be charged to those funds. Where the social distancing hotels will be charged to those funds. And then as we move forward, all right, so there will be certain lessons learned out of COVID that are going to improve our system, as hard as that is to understand. But our departments are looking at their services saying, we're now doing things that we thought of as ideas for exploration. We're doing them at scale. So, we're looking at, are there automations of data systems? Can we automate something that in the past has required us to use a scanner in an office that has a signature that gets rescanned? Can we do something different? Or if we start to hear of requests from childcare or long-term care providers, can we respond to those requests out of those funds? So Councilman, this is something that I know Mike Chambers has taken the lead on. He's actively managing those resources and those requests. I have to acknowledge, Mike he's working a lot of hours. He and I were Saturday and Sunday on the standing up of that hotel, just working constantly. As was the law department, as was the Office of Homeless Services. And we all recognize, it's not our job to spend the money. Our job is to respond to the need. But to respond to the need, we have to quickly come up with a proposal. We have to present that proposal and get input. And then as effectively as possible, implement a system that actually is effective. And that's what we're doing. And you're going to see as the year goes on, more and more of those proposals and programs.
How much have you spent so far or encumbered so far?
Unfortunately, I don't have a number here. I mean, I'll find out from Mike Chambers, and we'll get an answer.
And this is my last question, maybe comment. Again, when it comes to the nursing homes, Terry Allen has put out a list of which nursing homes have had it in their patient ranks and in the resident ranks and in their employee ranks. And the concern is you don't want to overwhelm any particular nursing home any more than we wanted to overwhelm the hospital systems. I'm hoping that there's a strategy for assisting nursing homes with staffing levels. When employees have to leave, is there any creative way that we can, as a county, can be a resource to help nursing homes with staffing levels? Because it is a contact sport in a nursing home. They have to have the PPE and they have to engage residents closely and transferring from wheelchairs to beds and showers to any other forms of physical contact. So any help that that they ask for, I would consider that a high priority.
Well, as I said, this is the area where I'm working very closely with Tracy Mason. She's engaging those organizations. She's hearing what they need now and responding to them, and she's going to be doing more of that. And pretty clearly, we need those businesses to tell us what their business need is, and it's something that we can then respond to.
Great. All right. Thank you.
Is there anyone else before we go back to Councilman Miller, Councilwoman Brown, and then Miller?
Thank you, Councilwoman Conwell. Congratulations on getting this far. Well deserved. You've been doing a great job. I just have a couple of questions with regards to the reopening of the county and some of the public coming back into our facilities. Has there been any thought to adjusting the building spaces, creating safer workspaces like partitions or things like that? Can you touch on that for us?
I can. First, thank you for the compliment. I appreciate it. The buildings we are walking the buildings on a regular basis, charting what needs to occur. And we've begun to work with public works and public work contractors to begin to understand what needs are recommended and how do we implement those needs. It's safe to say that we will be taking enormous precautions when that time comes. I don't have a date, by the way. If there are any questions, are we going back this day? Are we going back that day? There isn't a date yet because we're going to make sure that our buildings are safe first and foremost for our staff, for our employees, but also the residents who are coming in. So we're going to look at things like partitions, like spacing, at building capacity, at signage and messaging, because we want folks to understand that there are options for them. I'd like to just share. Job and Family Services began exploring a work from home model last year, just talking about it. And I have natural concerns about work from home in terms of confidentiality, in terms of performance, in terms of allowing people to have a work-life balance. I got to tell you right now, 91% of the eligibility specialists are working from home, and they are doing an amazing job. I can't say enough about the quality of the work being done by eligibility specialists, by their supervisors, by their center managers. They are responding to SNAP and Medicaid and TANF applications at a level and a responsiveness that it starts to beg the question, who should come back and why? If we are being that effective, we're there to serve the residents. If we can have a call center where a lot of days, there's no wait time for SNAP. Literally, there is no wait time. You make your way through the phone tree and the person answers the phone as soon as you put in your zip code. It's amazing. And if we can do that, shouldn't we keep doing that? So we're asking that question. I believe there will always be a place for someone to go to get a face-to-face service. I believe that. But I also believe that our residents expect us to be responsive. If they're calling us, they have an urgent need. And if we can address that need on a phone call, instead of saying, get on a bus or get a ride and park and watch your meeting and then clear security and then stand in line and wait to be called, and then you'll get your need, then I think we should address it as quickly as possible. And if we can do that through this phone system, we really should. Same thing should be said for child support. Tiffany Dobbins-Brazelton has caught up. She's moving very fast to get child support working from home. Child welfare, start their day at home, go out to the community with PPE, and then finish their day at home if they can. And so you're asking the question about the buildings and what we should do. The answer is yes, we will have open buildings at some point. We know that. Those buildings will be safe and secure, but we will also be asking the question, what really needs to come back and what can stay if it's being more effective?
Well, I certainly appreciate that as it relates to opening it up back to the public, but I know all of the employees did not have the option to work from home. So for those that do have to report to work on a day-to-day basis, I understand that there are still some spacing concerns as well as PPE relative to some of the HHS facilities, and I won't go into specifics, but I think you probably are aware, and if you need me to go into specifics, I will. But I would appreciate understanding the rationale or at least the approach in the future that you plan to implement to ensure our employee safety, because if they're not at their best, it's going to be impossible to serve the public who are also at a great need. So
I agree with you.
so any discussion, is that something that you and Mr. Dever intend to work on in the immediate future relative to addressing those that have to work within the report to work right now on a day-to-day basis? Is there
Yes.
discussion
We-
about that?
Yeah, we are doing that now. I think that was a part of the point of Leon Harris's survey, was to hear from people to say, listen, if you don't feel comfortable voicing your concerns, here's a survey where you can just submit them to it, and that's going to get reported to Leon and me. And folks are free. And I have to say, I've never heard of a county survey getting 78% response rate. Our employees want to share their opinions. It's outstanding work. It really is. Deborah and I are engaging consultants to begin to gather information. What do our buildings look like? What space is there? What is the nature of changes that the rest of, really the country is looking at to make the space safe and secure? And I think we have an obligation to our employees to really understand that. And just as I talked to Councilman Miller or Councilman Jones about the role of public health in changing people's behavior, yeah, I'm not an architect, I'm not an engineer, and I will rely on Mike Dever and their consultants to help us understand the body of work. What is literature saying we need to do to our buildings? How do we make those changes? What do we do? What do we need to put in place in terms of contracts or services to have the partitions in place, to have the self-cleaning stations for wipes in place? I know not everything has been available when employees have wanted it. It is improving, and as it improves, we push it out and people take advantage of it. So it's an evolving situation. We will have plans on on what we're proposing, and we will get staff input on those plans.
Excellent, and kudos to Dr. Harris for preparing that document and survey. And I'm sure I'm not sure how it was executed, but his reputation precedes him. So I know his colleagues have a tremendous amount of confidence in him as well. I also wanted to ask about the budget. I know that the county executive has made some indication that there may be some cuts. And as we talk about retrofitting and adding partitions and these things that need to improve our infrastructure at the county, that sounds like you're going to need more resources, which also ties my question to the HHS levy too. So the budget, have you put forth your proposal for budget cuts to the executive if there were any to be made?
I've submitted proposals to the executive. I haven't gone through with them. I haven't gone through those proposals with the executive yet. We were asked to make cuts, 15%. I can tell you our departments, not all of them were able to do that. We were also asked that these be strategic. This isn't across the board. And so I still need to meet with the county executive, the chief of staff and the team to review our proposals, to look at and see if they meet the expectations, if they're necessary, or if other changes have to be made. We're going to do that in the next couple of weeks. I just would speak to the other part of your question, which is those PPE or those different the different needs that need to occur for the buildings. How can we do that in an environment where we're considering cuts? Those are going to be chargeable to COVID. That's my understanding. So if we need to make changes to our building to have them be safe in response to COVID, I trust that Michael Dever understands those funds, and he's going to be our key resource, and he's going to help us do that.
That's excellent news. And last, if I may, Councilwoman Conwell.
Yes, ma'am.
The residents of Cuyahoga County were extremely supportive of the HHS levy, which was an increase. How will you communicate how we'll be utilizing that increase to them so that we can continue to maintain their confidence and the deliverables that we provide?
First, I agree with you. I think it was a huge vote of confidence. I can't tell you how much it meant to me personally, to our leadership team, and to the staff of DHHS. To get that type of vote, to win on that margin, meant everything in terms of the time that we're in, and the doubt about government. To have an increase supported in that way was just, it was humbling. And it was very gratifying for us to see that the public supports us in that way. As to what we plan to do, we made commitments in the campaign that there would be increased communication, that we would do a better job of saying what we do with those funds and what the funds mean. A lot of that already occurs. We have to admit that. I think Catherine Tkachuk's team in innovation does an outstanding job of producing reports that are published, that are available. I think when we took those reports to GCP, Greater Cleveland Partnership, and we showed them the 60 pages of quarterly reports on our progress and how we track ourselves against our peers, be they Columbus or Franklin County or Hamilton County or Allegheny County, they were blown away. I think, you know, I'm going to say this is on us. If our partners and people that we're counting on for support doesn't know we're producing reports that demonstrate our value, then it's our obligation to inform them and to help them kind of recognize that we are in many cases national leaders. We should be proud of saying that. We lead the nation in some of these programs. You know, not every community has a homeless system where you don't have to wait to get a shelter bed. We have that. Not every community, you know, has the universal pre-kindergarten program that we have, has a fatherhood program, has a reentry program. You know, I understand we get caught in media cycles where if we talked about it once, you don't get to talk about it, a period. I don't buy that. I feel like we should do a better job simply saying who we are and defining ourselves as opposed to waiting for somebody to define us.
Thank you. Thank you, Madam Chair. Thank you, Director Merriman.
Thank you. Can we go to Councilman Miller?
Yes, thank you very much, Madam Chair. And Director, I'm very, very happy that you prioritize this area. And my question is, what have you learned so far from the COVID-19 experience about how we can better deal with racial disparities in healthcare?
Well, to me, I think it's going to be one of the defining questions of the next decade. At least it should be. And I feel like, you know, so much of what we're going to learn is going to be based upon data that's not available yet. So I'll give you some preliminary thoughts, but I'm going to really hold to my belief that we really should be planning and acting on data, not on opinion and just sort of early perspective. At the same time, I do also commit to being iterative. I don't think we have to wait to act until we have all that data. We just have to be collecting data as we act so we can change. So some of the early things that are just, they're obvious and apparent, that there's disproportionality of the number of people that are in public systems that are African-American is higher than they represent in the community. So whether it's the homeless system, whether it's in congregate living facilities or in child welfare, we have to understand why that is the case. And I don't have answers to that. I can't tell you why is it that there are more African-American families involved in DCFS and why there are more children. I need Cindy Weiskettel to understand that and for her to review the data and for her to come back with meaningful solutions. I think that's the case for COVID as well. I think as we have really focused on building out a system to respond to COVID in the homeless system, you know, our early lessons learned are we can be successful. It's premature for us to say, you know, job well done. There's going to be no moment where we stand on the deck of an aircraft carrier that says mission accomplished. But I tell you, having Lutheran Metro Ministry rapidly stand up a hotel that would allow us to social distance. Oh, by the way, 4 of them. I mean, that's the sort of success that I think we owe it to the community to say public-private partnerships such as this, where a human service organization works with a collaboration of nonprofits with business owners. Hotels are businesses. Can we work this out? And through that kind of embracing of a public-private partnership, we can achieve something that other communities are now studying. We're at the end of May. We're nearing the end of May. We have other communities that come to us and say, how did you do that? And oh, by the way, can we use some of it as well? Can we refer some of our people into those hotels? I think that is something that we've learned. I do think we have a long history with permanent supportive housing. and other initiatives that we've shown public-private partnerships are an effective way to manage a huge problem. And I think we've relearned that, we've just expanded it. So that partnership now includes public health. That partnership now includes the Emergency Operations Center. So that's, I would say that's the first early lesson learned. And you will see that more and more as Reentry looks to establish their response. You know, I want them not asking me, I want them asking public health. And I'm going to facilitate the conversation so that Reentry can have its own approach. Maybe it borrows from homeless services and their lessons learned, or maybe it borrows from what public health is learning from ODRC. So, you know, I would also just advocate for having some designated resources. I just would tell you, having Sabrina Roberts be available to jump in and help manage those weekly meetings with public health, or having Leon be available to respond to PPE requests, having, you know, they're having Deanna Kirkpatrick manage communications. Yeah, I think management by committee is sometimes necessary. I don't know how effective it is. And being able to point to leaders that are supported and have you know, the types of professions and careers that you would expect, and to say, I need you to be responsible for this. I need you to carry this forward, has just been, it's been huge. I think we've seen that with Melissa Sirek and Ruth Gillette. I think they've done an outstanding job leading the homeless response. So, you know, for me, it is public-private partnership. I think it is data gathering and responding to data as we go, but also it's empowering leaders to be effective, to bring forward solutions, and to be iterative.
Well, Director, thank you for that response. And my next question is, what health and social problems do you think are going to be worse in the post-COVID-19 world that we're going to have to give some extra response to?
Oh, I hadn't thought of that. It's a great question. I am worried about the general mental health of our community, of our employees and our staff. People have been isolated for a long time. I think a lot of people have been traumatized, and you know, we're still in the middle of the virus. You know, we haven't gotten on the other side of it. We have no idea what this will be like in God willing, in 2 years, when we're on the other side of the virus, or in 16 months. And you know, I think this is going to play out still. And people that thought they had a level of safety, stability, are finding out that wasn't the case. I worry about children. You know, I've got 2 kids. They might even be watching now. Hey, kids. You know, they've been home. One of them finishes 8th grade tomorrow, or on Friday. Another is finishing, you know, 1st year of high school. You know, that was not my experience. I don't know what that experience will mean. And if you've gone to high school, and if you're the first person in your family that's completing high school or first completing college, that's a moment to celebrate. And if we're celebrating on Zoom and we're all moving on with our day, then we've missed something. And I don't know if we've tracked all the things that we've missed, but you know, at some point we do have to get back to being the communal society that we are. And I worry that as we lose those folks, are traumatized, and we're going to have to take another look at it.
Director, thanks. And final question. It's getting back to the here and now and what we're dealing with COVID-19 right now in Cuyahoga County. Where do you think the most serious clusters are? Do you think it's nursing homes? Do you think it's the prison population? Do you think it's the homeless community? Where are the groups that you're most concerned about right at this time?
Councilman, again, this is another question. I wish I had Terry Allen or Merle Gordon standing next to me to help answer it. They're not, so I'll give it a shot. You know, I do wish we had the kind of testing at the national level, at the universal level, to be able to answer that question. You know, if there's universal testing, there's universal data. Absent that, I think what we're left with is your question on your first round, which is behaviors. You know, where are the behaviors? What are the social contexts where people are unable to carry out a lot of the recommendations that have come from the CDC and the boards of health? And for me, that is the congregate settings. Whether we're talking about homeless individuals and, you know, a past practice of having individuals sleep in bunk beds, or we're talking about senior living or long-term care facilities where there's 2 people to a room and a rotation of staff, or we're talking about child welfare and residential centers. Each of those environments presents an opportunity where the physical structure of the building may not allow people to social distance in the way that we or they may like. And that's a lot of our response has been to that. And so for me, those are the natural concerns, because I think those are also disadvantaged populations. You know, I'm falling into what I think is potentially a trap. When we talk about populations, we lose track of the fact we're talking about a senior that's probably living in a center because they can't live independently alone. It's a complicated situation. It's not simple enough that you can't boil it down to a simple answer of, well, they should social distance. Well, there's probably a reason they're living there, and that probably is the best place for them. And we have to figure out how we can help them. Same thing with homelessness. And so, you know, those are the clusters that I'm worried about, because those are the clusters my directors are worried about, and because the County Board of Health and Metro Health are worried about.
Thank you very much, Madam Chair and Mr. Merriman.
Thank you, Mr. Miller. Is there any other council members that would like to chime in for questions? You're on mute, but I saw your mouth moving. Councilwoman Baker?
I am off mute. Thank you.
All right.
First of all, congratulations on nomination, Mr. Min. I think you're doing an outstanding job and very passionate about what you do, and I'm glad that you are part of our team. I did have a question, you know, sort of playing off of Councilman Miller in looking ahead of the pandemic that we're all dealing with, and what I hope is not cut and would be given, you know, some high consideration, especially understanding our high unemployment right now. We certainly know our businesses are trying to come back, and they're coming back perhaps at a 50% rate. But that leaves us with a high unemployment that hopefully that unemployment will come down. But we do have workforce development and career coaching for JFS participants. And I wondered if that is on your radar for continuing that program and making sure that those that graduate from high school, as you just said, or graduating from college and have perhaps fallen through the cracks because they socially have not been engaged and are waiting for their opportunity and may not have the skills to move forward. Are you thinking about them and what we can do to hopefully bridge that gap and give them the services that they need so they can be self-supporting and not in need of our county services, at least to the point where they would be if they're not working?
So first, Councilman Baker, thank you for the note of support. I think we missed a small portion of your question, but I want to reiterate to make sure I've got it correct. The real question is, you know, along workforce lines, how are we thinking about the needs, both I think of employees, unemployed individuals, and businesses? What is JFS and the other county agencies doing to prepare for those needs right now and as we move forward? I would say this. So yesterday morning, I had a call with Kevin Gowan, the Director of Job and Family Services, his administrative team, Frank Brickner, the Director of Ohio Means Jobs, and his administrative team. And we spent probably an hour talking about this question. In the same way you're going to hear me be deferential to the public health system on public health questions, you know, I feel that Ohio Means Jobs and the Workforce Development Organization is our workforce development organization. I want their input. We want to work together as a partner. And so that's why we got on the phone with Frank to say, COVID is upon us. What are you doing that's different? Because not only are you our peer and our colleague, you're also a subcontractor. We give them TANF money to operate. We give them additional money for youth and young adults. What's changed? What's your proposal for the next year that really looks to social distancing and having more people work from home, but then also anticipates needing to get people back to jobs, because both residents need that and employers need that. So that was a conversation in the morning, and by the end of the day, I was in a conversation with essentially the leadership team from the Cleveland Metropolitan School District and area foundations and workforce organizations asking that same question for the CMSD. And so this is a daily issue, and we are exploring how do we have an effective service that supports social distancing. So whether it's an online job fair, which I'm okay with, I think more importantly is online coaching. Some ongoing relationship that really helps people understand there are job opportunities out there, and what do you need to respond to those. I do also think now is a time where there are a lot of people that are at home, and we're exploring how do we get them access to online education or online training, so that when this ends, they're in a position to be more effective or more marketable. And we're looking to our providers to answer those questions. They are the experts. We have contracted with them because they're experts. We expect them to deliver. We haven't figured it out yet because we're just now emerging from stay at home.
Well, that's a great answer. I appreciate it. I'm glad to know it's on your radar and it's on others' radar. I don't want that to be something that's considered an easy cut of 15% because it's not immediately perhaps where we would be looking to give service, but we need to, as you understand, need to get people to work, and the unemployment rate keeps unbelievably going high. We need to do all we can to get people to have the skills that they need, whether they graduated high school or they're out of college. We don't want to lose those potential employees because they don't have access to any type of workforce training. So thank you, Mr. Merriman. Like I said, I think you're doing a great job. I'm glad to know that you're part of the team and look forward to working further with you.
Thank you.
All right, is there any other of my colleagues that would like to ask questions? All right, Mr. Merriman, I'll ask you a couple if you don't mind. Can you hear me?
Yes. Yes.
All right. One of our concerns pre-pandemic was the opioid settlement dollars that were allocated in the first phase for the hiring specialized the Health and Human Services employees. What is the status of the hiring process for that?
So DCFS was given approval to hire 31 advocates and 4 supervisors. We hired five advocates in March. They're in training, and that actually involves shadowing, where they're co-assigned cases. There's a recommendation to hire another 8. I think we have to recognize that hiring of these advocates is a slower process than normal. As what we're trying to do is we're trying to find advocates that have a history of substance abuse and or issues of substance abuse in their family enough and advance through their recovery to be a good county employee, and they can respond to the needs of someone else, not just their own needs. So we are being trained on how to document the use of the opioid funds. That training is being offered to DCFS as well as Family and Children First Council. I know there's a training, I think it was last Friday or maybe the prior Friday. I know there's a training this Friday. So we are in the process of documenting our uses and hiring staff and responding to the need.
All right, thank you. I know you were provided these questions prior to the meeting, and I have not received your written responses yet, so I look forward to them. I know we talked about it a little bit, but can you provide an update on the following HHS initiatives and where we stand moving forward? That's a long section, so I just want to zoom in on the DCFS Advisory Board, the legislation that was established and where we are at with that, and how many meetings have been. You know, I think I've kind of followed this, but just in case I missed out, if you can give me an update.
Yeah, so the advisory board is meeting still. So that those meetings were set, and they meet regularly. Gabrielle Celeste is the chair. We still have a few vacancies, and so we're looking to fill some vacancies. The groups are meeting. They have subgroups that have come out of the assignments where they're looking at data, messaging about how to keep kids safe, especially in this time. They meet every other month from 3:30 to 5:30. That continues now, and they're using a Zoom account that's been provided through CASE. The last meeting was April 28th. The next meeting is in June. So that group continues to move forward. They're active, they're responding to both the standing issues that we sat them on, as well as COVID related issues.
With our Zoom capability, are we able to put those links on our website, those meetings?
I'll confirm if that's the case.
Okay.
I know the meetings are presented and they're posted on the website. I'm clear that's the case. And so I'm going to assume that's the case. If it's not, I'll let you know and we'll work it out.
Okay. In terms of Cleveland Clergy Alliance, can you provide an update with that?
Yes, the Cleveland Clergy Alliance, they have a contract. The contract is through 2020. And at this point, they're continuing to be funded to provide services. We haven't made a decision about what to do in the future.
And as you know, and the reason I asked is because of the COVID-19, and I know many of the churches are closed. So just was wondering how that was, who's exactly, I guess, going to check on that or keep up.
I'll ask for an update from Tracy Mason. Again, at this point, we haven't cut contracts, but we are also checking in with our contractors and confirming who can still work.
Okay. All right. I'd like to open it. Any other further questions from the committee?
Director,
Yes.
Madam Chair.
Councilman Miller?
Madam Chair, to the director and my colleague, just an FYI that I've just received a request from Lorenzo Carter at the Cleveland Clergy Alliance saying that they are actively providing services and that they need an additional $100,000 to make it through the end of calendar year 2020. So we're going to have to deal with that request.
Okay. Thank you, Councilman Miller. Any other further questions for Mr. Merriman? All right.
Madam Chair,
Yes, Councilman Miller.
I would like to make a motion.
Before you do, Mr. Miller, I do have one other question, or at least a comment that I'd like to add before Mr. Miller makes a motion. Is that okay?
All right, Councilwoman Brown.
Okay, given the attention that has been highlighted, given the disparities in the African-American community, Franklin County just recently declared racism as a public health crisis. And so I don't know if you were aware of that, but it's certainly something that I think is a matter of concern here in Cuyahoga County as well. So I certainly would like to put that on your radar and begin discussions around that matter.
If I can respond, so I understand that First Year Cleveland has been a significant program and a response. I know that's one area that we've responded, and I have some past experience working in the Moms First program. That's a component of our response to infant mortality, and I think it shows that we have the ability to generate programs, and we can do this work. I don't know that it's gotten the attention that it deserves. And I know that this administration absolutely recognizes the detrimental impact of racism. This is a huge national issue, but we work at the local level, and we are challenged to come up with a local response. And that's a big part of the reason I've put it into my presentation today as a goal. I understand that if I do that, I'm going to be challenged on it, and I'm going to be asked to report it on it, and that's what we're going to do. And I don't think that this. For me, this is a long-standing issue. Like, I just will say that I worked at Moms First over 10 years ago, and we're still talking about this. So clearly no one has had the answer yet. But what we have is approaches. We have work, and we have to see that work grow and get to scale. And I'm absolutely committed to doing that.
Well, thank you. I have been working, I'm also on the Infant Mortality First Year Cleveland Advisory Board. I work very closely with Sabrina Roberts and Dr. Keegan, I can't, and Tracy Carter. And I know this has been something that we've been talking about along with Councilman Griffin on his side of working with Cleveland. So I appreciate you inserting it into the presentation. And I do expect to have much more in-depth conversations around this in the future. So congratulations on getting this far. I look forward to continue to working with you, and thank you for the work that you've done.
Thank you.
And I would just like to interject that me and Mr. Merriman did talk, I think last week or maybe a week and a half. I'm losing my days here in regards to housing equity and outside resources that is needed definitely to do some of the things that he wants to do in moving forward if he is so confirmed. So Mr. Miller, you were going to ask one last time, is there any further questions for Mr. Merriman at this time? If not, Mr. Miller, you can go ahead and make a motion.
Madam Chair, my colleagues, I would like to move to favorably recommend David Merriman for the position of HHS Director to be confirmed and for second reading suspension at the next council meeting.
Brown, second.
All right, it's been moved and seconded. Before we have the voice vote, I would like to just state to my colleagues and who all that's listening that I support Mr. Merriman's recommendation at this time. Mr. Merriman has been a team player in the Health and Human Services Agency throughout his tenure, and especially during this critical time we are all facing, I feel he has the background knowledge and foresight to help us through this time. So just wanted to let you know that, David, if I haven't in the past. And if we can have the voice vote, please, Madam Clerk.
Calling the roll on resolution number 2020-0092. For roll call vote, Ms. Conlon,
Yes.
Mr. Jones, Ms. Brown,
Yes.
Mr. Miller,
Yes.
Ms. Stevens, Mr. Jones,
All
Ms.
right.
Stevens,
They are both at work, so maybe they are preoccupied. But we have a quorum that says that we would like to move this to the full council meeting. So all in favor, say aye.
Aye.
Okay, so they are, David, how do you feel?
I feel better now. First, thank you. You've been very gracious, and I appreciate you. Good questions. Yeah, and I'm going to continue to be the partner that you've presented, and I look forward to working with each of you as well as county council as a body.
All right, and I know you've been in this role before, and this is your first virtual, so you're getting experience.
I'm learning.
If there's no other miscellaneous business from any of my colleagues, hearing none, I'd like to adjourn this meeting. Adios.
Bye-bye.